Okay, well, good afternoon, everyone. I am Koren Bloom, and I am the coordinator for Safe Kids Yellowstone County. And I was asked to give you some information about our coalition, the resources that we have, and what we do. So, let's see if I can get it to advance here. Safe Kids Yellowstone County is a coalition of Safe Kids worldwide. Safe Kids Worldwide is an organization that has coalitions all over the United States and across the globe. There are over 400 coalitions in the 49 states. I believe that South Dakota is the only one that does not have a coalition. Coalitions end up being groups of agencies and people that come together in order to help with the injury prevention. Each coalition has a lead agency. For instance, ours is American Medical Response. So AMR pays me to coordinate all of the activities for the Safe Kids Coalition. You can see here across the US as to where all of the coalitions are from Safe Kids Worldwide. And then here is a group of the agencies that have partnered with us in order to form Safe Kids Yellowstone County. So we have people from both hospitals, the fire departments, law enforcement. We have other agencies from all over that are coming in and partnering with us to do this education. Our mission is injury prevention through education. We feel that a lot of people in the state want to do what's right. Most parents are wanting to keep their children from being injured, and we feel that providing them the education and the resources in order to do that is very beneficial to them. So what is a preventable injury? Those are going to be your motor vehicle collisions, the poisoning, suffocation, drowning, pedestrian injuries, fire, and burn. And to give you guys an idea how big of a scope of issue that this is across the country and the world, it is preventable injuries are the #1 killer of children across the United States. Millions of children are injured every year, and it's a global problem. In the state of Montana, motor vehicle collisions are the leading cause of death and hospitalizations. It's the third leading reason for emergency room visits. Falls and being struck by something are the leading reason for emergency room visits in the state of Montana. We work through collecting and analyzing data. We advocate for new and improved laws. We've been active with HB 586, which is the child passenger safety law they have been working on recently up in Helena. And they did quite a few amendments in the committee, but we're hopeful that eventually we will be able to expand the protections for children in motor vehicles through legislation, because it seems that people transition their children out of a car seat earlier, and they look to the laws in order to help provide that guidance for when a child should be in what kind of car seat. As far as legislation goes, it's pretty rare that we get too active in a lot of legislation, just because we don't want it to take up more than 10% of our time, because we are a nonprofit. We have a bunch of different programs to help reach the parents and caregivers, and we do a bunch of social media content that we put out as well every month in order to deliver messages. So some of our programs, we have our at-home programs, which are like safe sleep. We do fire and burn prevention, water safety, poison prevention, fall prevention, and we also started a program last year on the safe storage of firearms. We talk with people about water safety, when they're out and about, for instance, like lakes and um, the rivers, etc. We have our sports safety programs where we talk about equipment use, wheeled sports safety, and in and around vehicle safety. And then on the road, we have our child passenger safety. We talk about pedestrian safety, teen driving safety, rail safety, and bike safety with a bunch of these families. So with our child passenger safety program, we have our monthly car seat checks are held at AMR the second Saturday of every month. We do quarterly car seat checks out at the Laurel EMS barn. We also do quarterly car seat checks over in Lockwood at their fire station. We've put on one child passenger safety technician course annually, and we also do a technician update. This makes sure that we are able to help different communities, and people are welcome to come from around the state in order to take that course. So we help people become certified child passenger safety technicians, as well as maintain that certification because it needs to be renewed every 2 years. We have in and around vehicles. We've talked with people about the dangers of leaving children alone in vehicles. We talk with children about playing in vehicles. We encourage families to lock their vehicles so that children don't get trapped inside. We've done trunk entrapment education. We talk with them about how far back that you need to be from a vehicle before a driver can see you. We talk about being safe passengers in the vehicle with some of these children as well when we are doing these activities. Sport safety and helmet use. We are able to measure and fit children with bike helmets, or we do a lot of multi-sport helmets so that it doesn't matter what activity that they are doing, they have a helmet that will be appropriate. With the sport safety, we talked about overuse injuries, we do concussion awareness, talk about proper hydration as well as appropriate equipment in order to help prevent injuries in sports. We have a medicine cabinet that we take out, and it will, as you can see in the pictures, we ask parents, is this candy or is this medicine? And it's been fun to take to some of the safety fairs that the hospitals here hold for their staff, because you get people that come in and they're confident that they are able to tell one from the other, and then they find out that they are not able to tell one from the other. And this is a physical display and kind of acts as a game where people take that messaging home quite a bit better than if it was just a conversation. We also work with the Rocky Mountain Poison Prevention Center in order to get materials and to help distribute those materials and talk about poison prevention in the home. Some of our partners do quite a bit with the fire and burn prevention. We work with several of the fire departments that are in Yellowstone County and talk with children about fire escape planning, what to do if there is a fire. I can't find any of the pictures for it, but one of the ones that we had the most fun with is that we got a whole bunch of hay bales all put together, and then we put a tarp over the top, and the children had to crawl and feel their way through in order to get out so that it would simulate what they could possibly experience in the event that they were in a building and needed to evacuate. Then, it was visibility was a problem. We do water safety education, and not just with pools and at home at the bathtub, but we also talk about the lakes and the rivers as well. One of our partners is a U.S. Water Rescue Dive Team, and they are able to show a bunch of the children and families, their boats and their scuba gear and everything for doing the water rescues. And last year, we also introduced our preteen driving program that we have partnered with Impact Teen Drivers on. And we have been doing what do you consider lethal presentations to the freshman classes in our local high schools. And we also did a Be the Change Fellowship in October. With the Be the Change Fellowship, we invited students to participate and come in from all of the high schools. We did the what do you consider lethal presentation, and we taught them how to go out and have an impact in their community. Some of them is postering. We've talked about talking with elementary students about being good passengers in the vehicle, how they can help and not be a distraction. They can go out and speak with the middle school children as well through some of their different programs they offer. And they can also put on events such as the one that you see up in the corner where we were at Montana Fair. They can do some of these activities at their school. We have encouraged them to try and do some rivalry challenges between the high schools for prom and different sporting events in order to encourage the students to do some positive, normal driving behaviors and to do that positivity instead of telling them you should not do this. We end up encouraging the students to say 94% of students don't text and drive, and try to bring awareness in a positive fashion so that we can encourage that good behavior without a bunch of negativity. So our approach for a bunch of this is identifying the risk injuries and frame the issue. Some of that research that we had done, where I was able to tell you what the numbers were from the state of Montana, is every 3 years we put an action plan together. We work with getting information from the Department of Public Health and Human Services as to the leading cause of injury, hospitalizations, and emergency department visits. We also look up data on whiskers in order to see if we are making an impact and trying to help trend the information so we can make sure that we are not seeing a high risk area that we are neglecting, but we are going ahead and bring awareness to any of those injuries. We develop preventive strategies and mobilize with our partners. And that is where another example of this would be the number of children that we have had who have gotten into firearms. We had tried the approach stating that we were talking about firearm safety, and we found that everybody will give us a very large berth if we're going to talk with them about firearm safety. But if we talk about safe storage of firearms and we have gun safes present, people will come up and talk with us about the gun safes, and it seems to be a less threatening conversation. And we use some of the Eddie Eagle handouts and materials and encourage parents to have a conversation with their children about what to do if they see a firearm, and we encourage the parents to have those conversations with their children. And we do not do any of that education ourselves because people have been, they have over the years, we have had maybe 5 students that end up coming to those programs. So it's a lot of work to try and put it together with no attendance at those programs. But we do the education and we try to raise awareness within the community. Some of the approaches that we use is we've talked about the public policy where we have spoken in favor of the child passenger safety laws, and we've offered ourselves up as informational witnesses so that in the event that those committee members are needing information, since I've personally been a child passenger safety technician and instructor since 2003. So it makes it so that we are providing resources in order to create good public policy. We expand our outreach through different partnerships. Every year we continue to grow. You would wonder how a retailer like Shields would be able to come in and do the injury prevention, but they have been a big supporter of our safe storage of firearms, and they're able to talk with families about different types of storage devices that they are able to purchase in order to meet the needs of that family. We have the engagement through digital media and as well as traditional media. So we have done quite a few posts. I usually do 2 to 3 posts per week for Facebook and Instagram. We also then have talked with the news media here in Billings between Color 8 and KTVQ and done interviews, especially when we're transitioning into winter, to remind people about not using their big winter jackets between the harness and the child, but to make sure that the child is harnessed in their car seat before they have that winter coat placed over them. So it depends on the risk area that we are talking about, because some of our partners do the education as well, such as the fire departments and law enforcement, depending on what the need is and what type of season that we are in. So we make sure that everybody is thoroughly represented when we are asked for some of those risk areas. So with that, that is the overview of what we do, and here is my contact information. Eddie Eagle is from the NRA, and the NRA will send the Eddie Eagle materials out to you. They go with the program, stop, don't touch, leave the area, tell an adult. And so I don't know how to stop sharing, so that we can just kind of talk. But
I, um,
that is not my masterpiece. So I
me neither.
apologize. I don't know how to make it stop. Oh, there it is.
Okay.
Okay, now we should go ahead and be back to just to where you have to look at me.
Okay.
So, but with that, I mean, the NRA has done a really good job of putting these books together, and Eddie Eagle goes in these stories and tells the children in the story, stop, don't touch, leave the area, tell an adult. So if you were playing over at a friend's house and found a firearm in the attic, or if you were walking down the street and came across a firearm, what should you do? And so it helps to, provide a resource for parents. By handing it to the parents, they've been more receptive to looking at that information and using that as a pathway for them to have a conversation with their kids. I think that some of the fear is they're not sure what is going to be taught, and it depends on what their situation is as to how they want that education to come across. So we have looked for different materials to help provide them with those resources.